The declaration confirming Uganda as Ebola-free was made here at the Mayor's Gardens in Mubende, which was the epicenter for the infection.
I now confirm that all transmission chains have been fully interrupted and take this opportunity to declare that the outbreak is over and Uganda is now free of active Ebola transmission.
The milestone announcement was made amidst an attendance of several people, including health workers who were critical to the response, partners, government, and the community members from Mubende and other surrounding districts.
Money alone cannot end it. Health workers cannot end it. The structures we have in place cannot end it. So the most important people in this response are the communities, the population of Mubende and Kasanda.
To our gratification, Uganda has proved it again. Even the most dangerous virus can be contained.
In 2022, we're able to demonstrate to the whole world that you can handle the most dangerous pathogen in a mobile lab.
The heads of missions present were also given time to speak.
And even if the current outbreak is declared over today, we cannot let down our guard. We still have a 90 days follow-up period ahead of us, with increased and reinforced surveillance, as well as survivor support and guidance to avoid reinfections.
The lack of approved therapeutics and vaccines for Sudan Ebola virus highlighted an opportunity for strengthening partnerships for rigorous research. Having candidate vaccines and therapeutics might improve our ability to prevent deaths during the next outbreak.
Our focus going forward will be to work with the Ministry of Education, Ministry of Health, and the district local governments to support the government in developing a system for disease surveillance, ensuring basic minimum services are available in the system, for example, WAS in hospitals.
So we'll continue with the community-based surveillance, where we have a number of the village health team and Red Cross volunteers working within their villages to be vigilant and observe what is happening, and then they make appropriate reports.
The Minister for Health, Dr. Jane Ruth Acheng, urged the implementing partners who have some unspent monies to work with the ministry to implement a one working plan as compared to using several implementing partners.
So resources will be used to support research in vaccines, therapeutics, diagnostics, ecological studies, and Ebola virus disease risk mapping. We shall focus on infection prevention and control in private and public health facilities. We shall support Ebola virus disease capacity building within the East African region.
Some of the health workers who attended the function raised their voices to demand for their unpaid allowances and salaries.
We were promised many things at the start, contracts, salaries, but up to now we are not contented. We just received the appointment with the risk allowance that we got from MSF. The ministry promised us to give us contracts with the salaries, which they have not yet fulfilled.
After 113 days, the Ebola outbreak in Uganda has been declared over. But the Minister for Health does urge Ugandans to remain alert and vigilant because nobody knows when and where the next outbreak will happen. Walter Mwesigye, NTV, Mubende District.